वेलकम व्यूवर्स। आज हमारे साथ में है डॉक्टर इंदु अर्नेजा जी, गेस्ट स्पीकर, डॉक्टर आनंद कुमार जी, प्रेसिडेंट इंडियन एकेडमी ऑफ हेल्थ साइकोलॉजी, डॉक्टर विस्मिता पालीवाल, हेड डिपार्टमेंट ऑफ क्लिनिकल साइकोलॉजी, अमेठी यूनिवर्सिटी राजस्थान। अब मैं इनवाइट कर रहा हूं आनंद कुमार जी को, प्रेसिडेंट IHP, टू इंट्रोड्यूस द स्पीकर and invite her for the talk. Anand sir, please.
Thank you, Dr. Rakesh Jain ji, and welcome Dr. Indu Arneja ji. My dear viewers, today we are having with us a very renowned practicing psychologist of Delhi, Dr. Indu Arneja. She is founder director of Indian Institute of Healthcare Communication. In her leadership, more than 1,500 skill building programs have been conducted for more than 100 organizations across the country. That's great. She is visiting professor of IIM Ahmedabad, Delhi Judicial Academy, Maulana Azad Medical College, and Delhi University. She is core group member of Medical Health and National Human Rights Commission, and she is having a lot of practical experiences in the area of healthcare. So we are feeling blessed that we are having her with us, and she is going to deliver her lecture on core skills in communication with patients. So, Induji, I welcome you on behalf of Indian Academy of Health Psychology, and I request you to deliver your lecture. Thank you.
Thank you so much, sir. Thank you so much, Professor Anand, and also Dr. Rakesh Kumar Jain, for giving me this opportunity, because this is a topic very close to my heart. And for the last 10 years, I think I am on a mission to sensitize doctors and other healthcare professionals to understand the importance of communication with patients, because ultimately doctor patient communication is the center stage for effective patient care. And also at the same time, we know the kind of violence and aggressive reactions we are receiving across the country. Of course, not right now, because right now we are all affected by COVID-19. So the attention is altogether to a different subject. But before that, if I talk of, I think, a lot of aggressive reactions against the hospitals or against the doctors were seen. And whenever I went into the details of any incidents, the main root cause of the problem was communication failure. So for the last 10 years, I think I've done more than 1,500 programs across the country with the medical colleges and around 100 hospitals across the country, where I'm trying to help people to understand what is the importance of communication in healthcare. Incidentally, usually people think communication is to do with soft skill training, which is actually not true. Clinical communication is completely different, because this is the communication that you would have with your patient or between you as your colleague when you are managing the patient. So it is handling medical information in a proper scientific professional way, so that you don't make any mistakes in the care. There are no errors in the care. And also at the same time, patient also requires certain amount of communication. It could be in terms of explaining what the illness is, or in terms of answering his or her questions, or even in terms of understanding what medicine I am taking, how long I have to take it, are there any side effects of the medicine, or is this surgery safe. So patient would have lot of information requirement. All that requires lot of understanding that there's a way to communicate and how to communicate. This is what I normally cover in my training program. So today I am going to specifically cover the core skills that you require to communicate with the patient. So agenda here is to help you identify that if you are able to look after these skills, definitely it's going to improve the quality of your healthcare outcome, and it is going to create better patient and professional satisfaction. So allow me a minute to share my screen with you, and then we start the discussion.
Madam, please share the screen through application window. Through application window. Share
Sir,
screen.
I am now I'm sharing. So can you see the slides
Yes.
I'm showing, sir?
Yes, madam. Make it
Is
full
it
screen.
visible? Oh, that's please let me know in case if the slides are not visible, because there have been instances in the past when the slides were not moving and nobody informed me. So that was this thing.
Okay.
So I've shared my first slide. Is it
is good,
visible,
madam.
sir?
Yeah,
Oh,
yes, madam.
great.
Please.
I have yeah, okay. So I am going to move this. I have moved this slide. Has it moved? So can you see this second
Yes,
slide now?
yes, madam. Please continue.
Is it moving? Is it moving now?
Yes,
Right, sir. Right. So as I was saying that we are going to discuss today about the core skills that are essential in the patient care or while communicating with the patient. And studies suggest that on an average, a doctor conducts around 250,000 patient interviews in a typical career. So considering the fact that a doctor has to actually interact with so many patients in the typical, in the career, the training given to actually interact or to conduct patient interview or conversate with the patient is very negligible. Till recent, actually, there was no such program for doctors or even for medical for nurses or other paramedical staff where they were actually specifically being trained how to interview the patient or how do you conversate with the patient. It is just recently that last year MCI has revised the curriculum, and they have come up with the ATCOM module, a new module that they have introduced called ATCOM, which is actually acronym for Attitude, Ethics, and Communication. So in this, three aspects are being covered about patient handling. It's about the attitude towards self, patient, and profession. Second is the ethics, and third is the communication. So now this is being integrated with the medical education, with the clinical skill program. We hope that in the years to come, maybe 5 or 10 years down the line, we will have doctors who have been formally trained in how to communicate with the patients. Whereas in the Western countries, communication training is an integral part of their medical education. So as a result, right from year one, they get training to work with patients or to work with the simulated patient. I have had my training in a number of places in US. So I got that opportunity to see how they are training their students in interacting with this simulated patient. But incidentally, in India, we are far, far behind that. Even a place like Sri Lanka, where I went 2 years ago as a resource person, they have a huge set of simulated patients who are used for practicing communication with the patient. So in our country, we are still much behind it, but I'm glad that at least now this has been formally addressed as part of the medical education. Studies suggest that 85% of our personal and professional success depends on our communication effectiveness. That is the importance of communication in any profession, be it medicine or non-medicine. And it's a study done by Harvard University. At the same time, studies also suggest that patients notice doctors' communication skills more than the clinical skills. Especially when they are meeting you for the first time, they hardly know your clinical skills. At the same time, not many of them even bother to check your qualification or from where you are trained. But if your communication with the patient is good, they more or less go back happy with the idea, oh, he's a nice doctor, he's a good doctor. At the same time, we also know that effective communication is major source of patient satisfaction. Half the illness actually gets cured if the doctor's communication with the patient is good. You may have seen many people going, 20 miles from their home to consult a doctor, a pediatrician, or an orthopedician. And when you ask them, why do you need to go so far when you have a doctor around your house? So they normally say, no, he's very nice, he's very knowledgeable. And you will actually realize that anybody who has a good practice, they would usually have a wonderful communication skills. And that is what actually satisfied the patient. Of course, studies also suggest patient satisfaction enhances patient's recovery. So it's not just about pleasing the patient, but scientifically it has been observed that if the patient goes back satisfied, his recovery improves because he starts healing himself on his own. On the other side, we also know that poor communication is the lead cause of medical errors. You'll be surprised to know that 60 to 70% of the errors that happen in patient care are actually result of poor communication. This communication failure could be either with the patient or even with your colleague, but that is a major cause of medical errors in patient care. 50% of the times, the concerns of the patients are not asked. They are treated like disease. They are treated like illness. So bed number so and so, or patient with hypertension, patient with diabetes, but they have number of concerns which need to be addressed. Half of the patients actually do not get an opportunity to even share their concern with the treating doctors. And poor communication is the major cause of patient dissatisfaction and violence in healthcare. Actually, lot of studies suggest that in 71% of the cases where the patient had sued the hospital or the doctors for medical negligence, the problem was not medical negligence, it was poor communication between the doctor and the patient, and that resulted in patient being unhappy or dissatisfied and then deciding to sue the hospital or the doctor. Studies also suggest that our communication with the patient is inadequate. We do not communicate enough. We do not answer their questions. We do not even care to build rapport. We just focus on treating the illness as the patient is just a case or a disease, and as a result we do not address their, especially the psychological or the emotional issues or even the financial issues. All those are left unaddressed in our communication. And even when we explain to the patient about the diagnosis or the process or the treatment, our communication does not actually make sense to them. Half of the families are not able to understand because the vocabulary we use, the techniques that we use, or even the speed at which we explain, they're not able to understand. But out of hesitation or fear or respect, they don't raise their voice. They don't kind of report back that I have not been able to understand. Also, doctor-patient communication does not meet the basic standards of informed decision making. We do not talk about what are the advantages or disadvantages of a procedure, or the risks involved, or the side effects of any treatment. All that is required to be shared with the patient, of course, in a staggered manner, in a gradual manner, in the right way. But that is the true purpose of informed decision making. And many of the healthcare professionals do not consider the family as the focus of their care. We may attend the patient very well, but when the family raises some issues or comes to us with some clarification, we usually do not consider them as the beneficiary of our care. Whereas if you see closely, when the patient is admitted in the hospital, probably he is far more comfortable. At least he has a bed, he's getting food to eat, he's getting medicines, he's being looked after. But the family who is actually attending the patient is waiting outside somewhere in the corridor. Especially if you look at the government hospitals that we have, there's hardly any place for the attendants to sit or to relax or even to have food, or even their toilet needs and other needs are not being looked after. So as a result, they are probably more stressed out than the patient in that situation. There are certain set of skills. If we can bring in those skills in our communication with the patient, I think a lot of good can happen. Things will be easy not only for the patient but also for the doctor and for the healthcare facilities. Patient will be happy, doctors will be happy, overall the work environment will be different. So let us discuss these skills one by one in brief. For example, the most essential communication skill that we all require, or the core skill that we all require, is ability to build quick rapport with the patient. Your accuracy of diagnosis and treatment greatly depends on your ability to build quick rapport. Especially if I talk about the government setup, where you hardly get any time to interact with the patient. I have seen number of hospitals where average patient time that you get to interact with the patient is not more than 5 minutes. So in those 5 minutes, you have to collect all the information. And if you are not able to build rapport, patient will not be comfortable sharing his or her personal information. So in order to get all the information, and we have to understand, patient would hold lot of information that is essential for making the diagnosis or for managing the treatment. And we really need to get hold of that information, but that will only happen if we are able to make the patient comfortable and make them feel that we are interested to listen to them. So I think the first essential skill that we need to focus on is to build quick rapport. Now, building rapport does not take time. It just requires intention. When the patient comes to the chamber, making eye contact, smiling at them, greeting them, or even responding to their greet, or asking them to sit down, or showing them where to sit. These are all small ways, very, very small ways. They don't take away much time, but they are good ways of building rapport. And building quick rapport helps you save time and energy, because the moment patient will become comfortable, it will be very easy for you to get all the information that you require. Another important skill that we all need to learn is the art of asking open-ended questions. Again, in the hurry to get the information from the patient, we have a tendency to ask close-ended questions. So usually we start asking, the patient says, fever hai, then the immediate question is, kitne din se hai, kab aata hai, kitna fever hota hai. So that means what we are doing is we are looking for just quick answers to our questions. Whereas there is a lot of information that the patient has, and if you allow the patient to speak, or asking the patient to just a simple question, like an opening question, if you ask, okay, what has brought you to me, or tell me how can I help you, tell me what is the purpose of your visit to the hospital. So when you ask an open-ended question, it compels the patient to speak in depth and also share more information with you. I mean, studies actually say, if you allow the patient to speak, half the diagnosis can be done by just listening to your patient. So ability to ask open-ended question, and that requires patience. Actually, we are so habit bound that we have tendency to ask closed-ended question. We think that by closed-ended question we are able to cover more areas. But in case, suppose if you forget to ask something, for example, a patient has come to radiology department, and the X-ray technician forgets to ask if the lady is carrying or if she's pregnant or not, and he exposes the patient to the X-ray because he has not asked the patient. So there's a possibility that the patient, pregnant woman, can get exposed to X-rays. So the crux here is that we need to ask open-ended question, allow the patient to narrate their story, observe the patient simultaneously, and you'll get a lot of information through that observation. Of course, close-ended questions can be asked, but they should be asked towards the end of the conversation or towards the end of the consultation. Patient would have a lot of questions to ask. Will I be all right? Will I be able to do what I was doing? For example, if it's a patient who's a rickshaw puller, so naturally, if he has met with an accident or he has a fractured foot, so his first concern will be, will I be able to walk again? Will I be able to do my rickshaw pulling once again? How long will it take for me to recover? Will I stay on bed for all this while? So they have a lot of concerns, they have a lot of questions, and it is very important to address these concerns. If we do not address these concerns, that leads to a lot of suffocation and dissatisfaction in the patient. Actually, addressing their concerns and answering their question is a wonderful way to build rapport and also win their trust that, oh, this doctor is knowledgeable or this doctor is ready to answer all my questions. I remember I had sent a relative of mine to a friend of mine who's a gynecologist. Now, this relative of mine had to undergo hysterosalpingography, and she had visited a number of gynecologists before she went to this friend of mine who is a gynecologist. So she and her husband asked n number of questions to this doctor about what is the procedure, how long will it take, will she be all right after it, how many days rest she will have to take, or what is the expenditure. So all these questions they kept asking. Actually, it turned out to be a lot of questions that they were asking. And at the end, the husband of this patient, he asked this gynecologist, I'm really sorry, I've asked you a lot of questions, so you must be really, upset. You must be really annoyed that this patient is very, is asking a lot of questions. But this gynecologist, in a very polite form, a polite tone, she said, that's my duty. It's my duty to answer you. So the fun is, this patient who went to 4 or 5 gynecologists immediately decided to get the procedure done at her hospital. So what I'm trying to say, when you address their concern, when you answer their question, it may take little time, but that is how they ultimately get satisfied and they finally decide to be with you. I think ultimately the purpose of practice is that we all want the patient to come to us and stay with us and get the treatment done by us. So addressing their concern should not be taken as a burden, but that should be taken as part of our responsibility to build rapport and also to satisfy them. Another important skill I think we all need to learn is listening attentively. Actually, listening attentively is a very hard skill to learn. Studies suggest that we interrupt the patient within 10 to 13 seconds of the patient starting to say something. And we usually interrupt them with close-ended question. Whereas if you listen attentively, make the patient comfortable and, kind of allow the patient to speak, half the illness actually gets cured. And second is, you will get to hear a lot of information from the patient. So again, listening attentively requires efforts, because you mindfully need to connect with the patient and communicate interest, to listen to the patient and also communicate that yes, you are understanding what the patient, whatever the patient is saying. So to listen attentively, there are little, again, it requires little skill. For example, leaning forward, making eye contact, nodding in between, or smiling whenever appropriate, or asking clarifying questions. These are few good ways to attentively listen to your patient. And if you are able to listen to your patient, I think, again, the patient is going to be very, very happy. I'm reminded of this narration by Viktor Frankl. He wrote in his book, I think the name of the book is In Search of a Man. He said that he could avert a patient actually committing suicide by just talking to the patient. Actually, in the middle of the night, he received a phone call from his patient that I am feeling very low and I feel like committing suicide and I'm really very depressed. He was miles away from this patient and didn't know how to handle it. And at that moment, he didn't know how to stop it or what to do. So what he did was he engaged this patient in, talking, and he attentively listened to her, asked questions, clarified a lot of things. So as a result, this patient was actually, very satisfied. After a couple of days, when he met this patient, he asked this patient, what made you change your mind? And she said, I was very glad to know that there is somebody who is ready to listen to my story in such an attentive manner. So actually listening attentively is therapeutic for the patient. And as healthcare professionals, we all must learn and develop this skill. Another important skill is assertion. Actually, assertion is a very effective communication skill where we are able to communicate in calm, positive, and a firm way without being aggressive or without actually passively accepting something wrong. For example, there are a number of times when there will be a disagreement between you and your patient. It could be maybe, for example, you want the patient to get admitted, or maybe you want the patient to get operated, or you want the patient to, take this medicine or stop a medicine, and the patient does not agree. So there is a disagreement between you and the patient, and you need to really explain to the patient why the patient needs admission or surgery or this medication. So the tendency is, when the patient does not agree with us, we become annoyed, unhappy, and we become aggressive. But assertion is one communication skill where we actually answer their questions or explain to them, but we do not become aggressive. So it is a skill that comes with a lot of practice. But once you have learned it, trust me, your patient is more likely to listen to you and comply with you. because many a times patient will even have unrealistic expectation. For example, sometimes the attendant would say, doctor साहब कितना भी पैसा लग जाए मेरे patient को बचा लीजिए. So for a moment you will have a thought in your mind, can money save everything? And money is not the solution for everything. So rather than getting annoyed, if you're able to explain to the patient, the patient's attendant, the condition of the patient and how is the patient responding to the treatment, or what is the the comorbidities that the patient is suffering with. So what you are trying to do in a firm way, you are explaining to the patient's family that you need to fine tune your expectation. We shall do our best to save the patient, but let's see how the patient responds to the treatment. So what you are doing, you are not being aggressive, but in an assertive manner, you are actually fine-tuning the patient's or the family's unrealistic expectation. And there will be a lot of opportunities where the patient or the family might act aggressive. And if you are able to assert without being aggressive, you can avert most of the situations from actually turning into any violent attack or violent behavior by the patient. Because aggression can be fueled with only one thing, and that is aggression. And aggression can be held amicably with only one thing, and that is assertion. So it's a very important skill that the doctors and the healthcare professionals must learn, because that's the way they should be communicating with the patient and the family. Empathy. That's another core skill that we all must have. It's a great tool to create solidarity with the patient. So empathy is when you're able to put yourself in the other person's position and look at situation from their point of view. When you start practicing empathy, you're able to see their world through their eyes. You are able to appreciate them as human beings without being judgmental of their behavior. Even at times when they are not listening to you, or they are not agreeing to you, or even they are acting aggressive, you will not be annoyed with them, but you will be able to see their perspective, empathize with them, and appreciate and understand their feeling. So once you will start practicing empathy, your communication will have lot of understanding of their perspective, and you will be able to communicate your understanding to the patient and the family. And that is very assuring to the patient that the doctor is able to see my point of view, understands my point of view, and appreciates and respects my point of view. And I think empathy is one virtue that we really require among all healthcare professionals, especially to avert aggressive reactions and the violence at the workplace. And when I talk about empathy, it's not about just the doctors who need to practice empathy. Every healthcare professional in any healthcare facility needs to understand it. For example, in critical care area, it is not just the doctor who will be interacting with the patient's family. It could be the nurse, it could be the support staff, it could be even the security staff who will be dealing with the patient's family. So they need to understand when the patient is in critical condition, the family is actually looming under a very big fear, that is fear of death. So naturally their behavior, their reaction will not be normal. They will not be relaxed or comfortable or sensible even in their responses. So we need to understand that thing and communicate with greater understanding with them. Another important skill that we require is negotiation skill. See, there was a time when patients never asked any questions. They had so much of trust and faith in the doctor that they would never dare even ask, why do I need this medicine? Or why do I need surgery? For example, if the doctor said, you need surgery, or you need to get admitted, the patient and the family will just blindly, quietly accept it. But now, with the advancement of time, patients being educated, patient having access to secondary source of information, they want to now understand what is the illness, how serious is the illness, what are the options available, is surgery the only option, or can we manage it at home, can we try some other mode of treatment. So all this requires discussing with the patient's family, explaining to them what is the situation or what are the options available, then negotiating with the patient. So for a minute, it might sound slightly, disturbing for the doctor to think that, okay, I have to negotiate now with the patient. You have to understand that now your role from a decision maker has changed to facilitation of decision maker. Because when you facilitate decision making, you consider your patient and their family's perspective also. Without compromising the clinical goals, you need to help the patient and the family take a call or take a decision. For example, if it's a cancer patient and you are recommending admission, but the patient and the family says, no, I don't want to die in a hospital. I want to stay at home. I want to stay with my family. So probably there you will have to respect and accept your patient's decision and help them now, in case if they want to stay at home and look after the patient at home, how will they manage patient's symptoms or whatever the situation is at home. So their negotiation and collaboration skills is something that's actually a new concept, but treatment or the patient care now becoming patient-centered care. Earlier it was a doctor-centered practice, now it is a patient-centered practice. So negotiation skills, collaborative skills are new skills I think the doctors need to learn, and that's actually going to make you peaceful and happy, because when you negotiate with them and when you explain them about the outcome of the treatment modality or the risks involved or the disadvantages and the advantages, somewhere the responsibility also becomes shared. So the family cannot completely blame you for the outcome. And especially when you have involved them in decision making, so they will know that they were part and parcel of the discussion and decision making. So they cannot blame the treating doctor for the failure of treatment. So it actually goes in our favor if we learn these skills and practice it while handling the patients. Display of respect and care, I think this is something we got to really bring in at every point of contact. Patients do not get in contact only with the doctor. Actually, right from the entry to the hospital, at the parking place, then again at the security guard, again at the registration counter, and then the doctor, then the nurse, a dressing room, injection room, pharmacy, radiology, lab. There are so many contact points. So at every place, there has to be display of respect and care. Patients do not like to be ill-treated. They like to be treated like an equal human being and cared accordingly. So I think this is another skill that we really need to, enforce in our work culture and also inculcate among all our healthcare professionals. Patients literally hand over their body to us when they come to the hospital. So when we are examining the patient or handling the patient, we need to respect patient's privacy. Especially when you are doing history taking, we need to ensure that the patient is alone with you, or maybe the patient's attendant, rather than having so many patients, other patients in the same chamber. Similarly, when they are sharing their information, of course, by the guidebook or by the rules, we are supposed to ensure patients' information's confidentiality because it's a privileged information. So legally also we are bound to, look after the patient's information's confidentiality. But at the same time, we need to assure to the patient and also ensure that we will make sure that the patient's information is not shared with anybody else who is not the right person to deal with it. Valuing patients' time is actually a demonstration of your time management. We normally, many times, make the patient wait unnecessarily. And then at the end, we say, sorry, it will not be done today. Please come tomorrow. So it's not failure on the patient's part. I would say it's a failure on our part of time management. So we really need to respect our time and the time of patient, especially considering the kind of clientele we get in the government setup. Most of the patients are daily wagers. They miss their one day salary when they come to the hospital. They have to take leave or a half day or a medical leave to visit the hospital. So making them come again and again, it's going to actually waste their time and it's not going to help us in any way. So planning the work in a manner so that every patient gets a chance to meet you, and also their time is valued. That's very important, that we need to really inculcate in our practice. Now, there are a lot of intense communication that happens between the doctors and the patient and their family. For example, breaking bad news, or end of life care, or grief counseling. So these are all intense communication. They require advanced level of communication skills. So they are more or less like counseling skills that we require in counseling, where you need to empathize with the patient, respect the patient, understand what they are going through, be non-judgmental, accept their reaction. And that's actually, that comes with lot of practice and lot of training. Lot of protocols are available, training programs are available to empower you with these skills. For example, of breaking bad news, or updating the patient's family about the patient's condition, or how do you handle end of life care, or how do you do grief counseling. So all this again requires training, and this has to be part and parcel of the core skills that the doctors must practice. This can actually help avert a lot of violence and aggressive reactions in patient care. Practicing these skills will lead to reduce medical errors and also will improve the health outcome. Of course, patients will go satisfied because their concerns have been addressed. Transparency has been demonstrated. They have been explained about the outcome. They are prepared for the outcome. So all this is going to improve the patient satisfaction, and also the risk of allegation of medical negligence also would get reduced, because most of the times they are unhappy that they were not informed or they were not asked. So if you communicate with them, they would have less chances of alleging you for medical negligence. Of course, practicing these skills will ensure professional satisfaction. I think that is the ultimate objective of all professions. So we all need to understand that if we are not happy doing what we are doing, that means we are not doing it in the right way. And training is the way to improve your skill. If you think if you think training is expensive, I would say try ignorance, and you watch and see. Thank you so much.
Thank you, madam. Thank you. Dr. Vismita, please.
So,
Hello.
in case there are questions,
Hello,
we can.
everyone. I think there is. Yeah. Hello, everyone. Thank you so much, ma'am, for such a good talk. And seriously, a very, very quality presentation that we have had today. I'm sorry. Yeah. So, ma'am, can you please elaborate some counseling skills which are applicable for teenagers in current scenario?
See, I think most important is acceptance. Usually these teenagers feel that they are not accepted as they are. With the rapid shift in generation, the generations are evolving at a much faster pace. So as a result, we are at times not able to accept their behavior, or the way they handle their life, or the way they are leading their life. So as a result, they usually feel rejection, correction, or instructions from their parents, teachers, and people around them. So as a result, I think the most important skill that we all need to practice with the teenager is acceptance. Second is empathy. I think we need to really understand what are their challenges. Not that they are, since they have so many facilities available, so probably they are not facing any challenges. They have their own set of challenges. So empathizing and understanding what are their challenges would help build rapport. Third skill that I always say to the parents is go down to their level rather than expecting them to come to your level, because they will not be able to come to your age. So you need to actually kind of become their friend. When I say you become their friend, that means you are not being judgmental, or you're not finding faults, or you're not instructing, you're not kind of always in that mode to make them perfect. But if you become friend to them, then in a good way, you can actually, maybe give a suggestion, areas where they need to work or change or improve. So these are a couple of skills, I think. Another thing that I think as parents and as teachers, we need to understand that we don't have to always operate from the parent ego state. We have to go down to adult ego state to help our teenagers actually also to move from child ego state to adult ego state. So we really need to have a wonderful rapport, wonderful relationship with them when we treat them as adults, and we also stay in the adult ego state. I hope that answers the question.
Surely, ma'am. Thank you so much, ma'am. The next question which was asked is that, ma'am, as such, we talked about a relationship between doctor and a patient. And what are the important points that a counselor or a psychologist should keep in mind in order to develop a therapeutic relationship and take it to a next level?
I think therapeutic alliance is something that we always talk about whenever we talk about counseling the patient. So we really need to be very good at, first of all, building rapport. That's very essential. And then negotiating agenda. I think that's very important, because both the client and the psychologist need to be very clear about what are they working on. The patient may have some issue on his mind. As a therapist, you may identify something. So you need to really negotiate with your patient and help the patient see. For example, maybe the patient is picking up an issue which is less important according to you, and something more seems to be vital or crucial to be discussed in that. So you can, in a subtle way, you can bring forth to the patient issue that you think you need to really address, and that is how you negotiate with the patient and set agenda. So therapeutic alliance also requires us to be non-judgmental, to be empathetic, to be respectful, and accepting them as they are. And that needs to be communicated to the patient so that they become comfortable with us. And especially in counseling sessions, patients literally come forth with a lot of sensitive personal information. So we really need to actually verbally communicate to them that your information that you're sharing with me is going to be only between you and me. I mean, this is what I do every time I start a counseling session. So I make it a point to verbally tell to the patient that the information that you're going to share with me is completely confidential, and it is going to be only between you and me. I will only be sharing your information in case if you're going to harm yourself or anybody else. Otherwise, that's the way I handle. So this is what I normally practice with my clients.
Yes, ma'am, definitely. Thank you. No doubt about it that an non-judgmental, unbiased, and collaborative approach, unconditional acceptance towards the patient or the client is the first step towards establishing a good therapeutic relationship. Definitely, ma'am. Ma'am, we have one more question, which is, I think, very relevant in these times. It's how to improve communication skills in government hospitals, because government hospitals, doctors get only 3 to 5 minutes maximum to interact with the patient. So what kind of communication skills in that particular time frame is required or should be practiced?
Good. I think it's a very relevant question, and let me give you 3-4 points to support what I normally say to this. Communication is not what you say. Communication is how you say. So even if you get 2, 3, or 5 minutes to interact with your patient, as I said, building rapport does not require time. It just requires intention. So in those 2, 3 minutes, how you treat your patient? Do you make eye contact? Do you greet the patient? Forget about greeting. Normally, patients greet us when they come to the government hospital. Do you respond to their greet? Do you show them where to sit? Do you do a small talk before you start a big talk? So these are simple ways, very quick. I mean, maybe explaining has taken maybe 30 seconds, but doing will not take more than 5 seconds, and they are more than enough. Second is, patients, when they come to a government hospital, honestly, if you trust me, they have least expectations from us. And our good behavior with them, respectful behavior with them, is something like they go back gaga, they go back happy. So what we have to remember is our communication with them has to be respectful. फॉर छोटा सा एग्जाम्पल लेती हूँ, जैसे कई बार हम अपने कमरे में खाना खा रहे होते हैं, पेशेंट कमरे में आ जाता है, हाउ डू वी नॉर्मली काइंड ऑफ रिस्पॉन्ड टू देम? क्या भैया दिख नहीं रहा खाना खा रहे हैं? अब मैंने ये कहा कि दिख नहीं रहा खाना खा रहे हैं, और ये ना कह के अगर मैं ये कहती हूँ भाई साहब 5 मिनट बार वेट कर लीजिए, मैं खाना खा लूं, अभी आपसे बात करती हूँ, अब इन दोनों चीजों में कोई टाइम नहीं लगा, बट the impact of the communication is going to be completely different. So as I said earlier also, communication is not what you say, communication is how you say. If you're respectful to your patient, if you're communicating well, again, practicing, knowing these core skills, like for example, asking important question, building rapport, making a patient comfortable, that's going to save your time. Even patient would value your time. So in those 3 to 5 minutes, you can do qualitative interaction by attentively listening to your patient, attending to the patient with 100% of attention, and allowing the patient to speak, noting down what the patient is saying, making your patient comfortable, I think. And also, in case if you see there's a patient who requires detailed working, I normally tell my doctors that have you heard of Pareto's law? So Pareto's law is law of 80-20. 80% of the patients can be attended within 1 or 2 minutes. For example, if they come with cough, cold, simple condition, you will not take more than 1 or 2 minutes to send the patient off. But there will be 20 to 30% of the patients who require detailed working. So in government setup, make sure that you don't miss these patients. They need to be attended. So maybe you can make them wait, you can call them again, you can ask your subordinates to work on those patients. So you have to find ways to make sure that you attend to these patients. And when you make them wait and attend them later on, they are more than happy and thankful to you for giving your time. So that is how we have to be, mindfully valuing their time and also attending to them in the right way. Yes, please.
Thank you so much, ma'am. Indeed. So, guys, it doesn't actually makes a difference that how much minutes you have to interact with the patients. The smile, the way you talk, and the way you convey the message is something that is very important in order to get the rapport going. So, yes, ma'am. Related to what we have right now discussed, Aarti ma'am from Jammu has asked one question. First of all, hello ma'am, and the question is that is it true, or do you think, ma'am, that doctors or the counselors in the starting of their journey, they are patient and they give time to the patients and they have all these approach that you have right now discussed, but as they are very overloaded by the burden, and when years go by, they start losing that touch, they start losing that patience. So how to rejuvenate or how to get back to it again?
See, most of the learning these medical students have is through observation of their seniors. Now, in case if they had a senior who was very well behaved with the patient or was very, considerate with the patient, chances are that the trainee doctors also would acquire those, skills. But incidentally, we don't have very many good role models because even they have not had any training. So as a result, they also think that this is how we need to behave with the patient. That is one thing. Second thing is that when you get overloaded with the things, that means somewhere we need to really understand the concept of self-care. When I talk about self-care, I tell to the doctors, how many of you take your 3 meals on regular basis? 70 to 80% of them miss their breakfast. When you come to a hospital and you know it's an overworked hospital, and you will be actually running from one place to another, and you have come empty stomach, you are likely to be, either fainting or stressed out or irritated. So somewhere I think the concept of self-care has to be very seriously inculcated, not only among doctors. I think anybody who is into a laborious work like this. Healthcare is a very laborious industry. It's very demanding. You're dealing with sickness, you're dealing with patients, you're dealing with emotions. So you got to be fit to deal with it. So things like food, sleep, 6 to 8 hours sleep is must. How many of the doctors do really keep sleep as their priority? If you look after your sleep, most of your physical and mental wear and tear will be looked after. And when you take your breakfast, come to your workplace in a cheerful, fresh mood, your interaction with the patient will be different. It's not always the workload. We normally think it is the workload, but it is because I am not looking after myself, so I get stressed out even with little trigger. So my definition of stress is, usually people say stress is external factors leading to stress. So my definition of stress is external factors leading to stress divided by your coping ability. डिनोमिनेटर बड़ा कर दीजिए, न्यूमरेटर अपने आप बड़ा हो जाएगा, छोटा हो जाएगा, न्यूमरेटर अपने आप छोटा हो जाएगा. सो वर्क ऑन योरसेल्फ, अपनी कोपिंग एबिलिटी बढ़ाइए, अपना रेजिलियंस बढ़ाइए, अपने इमोशनल हेल्थ को अच्छा करिए, अपनी साइकोलॉजिकल हेल्थ को अच्छा करिए, cheerful रहे. You will be able to handle any amount of stress. That is something we really need to focus on.
Very nicely put up, ma'am, that time management and self-management are the keys to rejuvenate yourself and treat every day as a new day, and automatically that vibe and that smile and that communication tactics will come back to you. So same is with our counselors who are actually having a lot of secondary trauma because they are drained with all the problems that they hear and listen from their clients. So same is applicable to them as well. So yeah, guys, due to the limitations of time, we will just be taking limited questions. So I'm sorry if there are any questions left. If we will have future sessions from ma'am, and maybe ma'am will be seeing your comments in our section and then addressing some questions of our viewers. So thank you so much, ma'am, for being with us and for addressing the questions of our audience. Over to President Sir to address our speaker of the evening.
Thank you.
Thank you, Vismita. And thanks a lot, Dr. Induji. It was really a wonderful presentation, very informative, and it was just reflecting your skills, your practice experience, everything. So it was in a very simple way. You have just explained that 85% success depends upon patients and therapist communication and interaction. It was wonderful. And effective communication is a major source of patient satisfaction. You told that poor communication is the cause of patient's violence. Really, it is true. And about the important skills, the ability to bring quite quick rapport with patients, and the art of asking open-ended questions, ability to listen patiently and attentively, that was wonderful. And next thing you just explained, how to clarify doubts and concerns of the patient. It was very important. It is very important. And assertion ability to communicate in a calm and positive way. Assertion, that is also very, very important. And empathy without being judgmental. Really true. And explaining and renegotiating the disease management and the treatment with the clients and their family. Expressing rapport, respect, and care, that is the core component of skills, communication skills, and respecting patient's privacy and confidentiality. Very, very important that patient will only interact when you assure that your patient's information will be kept confidential and the privacy would be maintained. Time management and valuing the patient's time. That is also a core component for the doctors. They have to manage their time. So it was really a wonderful, wonderful speech and very informative. I think all the viewers will be very much benefited, and they will definitely just learn, and they will just adopt these skills in their practices. Thank you, madam. Thanks a lot.
Thank you so much, sir. Thank you.
Thank you, sir. Thank you, madam. Dr. Vismita, for vote of thanks, please. Dr. Vismita, unmute yourself, please. Dr. Vismita. Dr. Vismita. Dr. Vismita, unmute yourself. Vismita. Sir, आप कर दीजिए. So,
Hello.
oh, sir, please. Sir, please, आप कर दीजिए.
Yes. You please. Dr. Sab,
Okay.
आप कर दो.
ठीक है.
Thanks.
Okay. Thank you, madam, very much for accepting our request to be here in the webinar. It was really very useful session. In fact, I wanted to share my own personal experience. Once I was hospitalized in ICU, and doctor or any medical professional in the ICU did not ask me even a single question, what is your problem? एक बार भी नहीं मुझसे पूछा कि तो समस्या क्या हुई है. They were just looking into my reports, making a diagnosis, prescribing me a bucket of medicines.
Oh my goodness.
And the condition I was experiencing, I had experienced previously also on 2-3 occasions. It was known to me. I could have made them known what is my condition, what is my problem. They kept me there for 16 hours. And ultimately, when I got fed up, I had to pressurize the doctor to discharge me from that place. So the only question I had, कि एक बार भी किसी ने मुझसे ये नहीं पूछा कि तुमको परेशानी क्या है. 16 hours. 16 hours.
That connection is missing. Connection is missing. That
is the importance. और मैं आज तक भी सोचता हूँ कि आज तक भी मुझसे किसी ने नहीं पूछा. जाते ही मुझे किसी ने नहीं बताया कि वो मुझे ब्रीफिंग भी नहीं की कि आपकी क्या मेडिकल कंडीशन थी, क्या प्रॉब्लम थी, क्या ट्रीटमेंट है, क्या आउटकम है. किसी ने ये भी नहीं बताया. तो ये आपका टॉपिक है बहुत रिलेवेंट टॉपिक है. और यदि ये बात जो आपका मिशन है, ये मिशन आपका सक्सेसफुल हो जाए तो सर्टेनली इससे पेशेंट के इम्प्रूवमेंट रेट बढ़ेगी इससे. और जो ये वायलेंस है अग्रेसिव बिहेवियर ऑफ पेशेंट एंड केयर गिवर्स टुवर्ड्स द हॉस्पिटल एंड टुवर्ड्स द डॉक्टर, ये रिड्यूस होगा. सो यू आर ट्रू प्रैक्टिशनर्स ऑफ हेल्थ साइकोलॉजी. Dr. Vismita, please continue. Dr. Vismita.
Thank you so much. Thank you.
Thank you. Thank you, sir. Thank you. Thank you, everyone. We have an overwhelming audience from throughout India and abroad. And everyone is appreciating the session as usual. Guys, your love is commendable and invaluable to us. Keep on appreciating us like this and keep on showering us with all your blessings. And thank you so much for the speaker of evening, Dr. Indu ma'am. Ma'am, you explained everything so nicely, and everything that you explained has a very, very applicable, practical approach. And everyone should actually get into, not only the doctors, everyone who is interacting with someone can accommodate these things into their lifestyles in order to increase whatever way they are saying things in order to increase its value. All these things are applicable in that daily routine activity also, and it is not just a part of psychology, it is a part of behavioral science in total, taking all the interdisciplinary dimensions in mind. No matter if you are a lawyer, no matter if you are in management, no matter wherever you are, these type of skills are required for a therapeutic alliance or for a particular relationship management anywhere. It is applicable in every field. So thank you so much, ma'am, to give us such a huge insight into it. And the mind who is behind it, Professor Anand Kumar sir, President IAHP, many thanks to him to provide us this platform in which all the people from abroad and India are able to see are able to connect with all the eminent person who are specialized in that particular field. Guys, these resource persons whom we get for you are working in that particular area since years. So all they are doing, उनकी जो सालों की मेहनत है, let me just quote it in a Hindi, उनकी जो सालों की मेहनत है वो हम कंपाइल करके आपको कम से कम टाइम के अंदर आप तक ये नॉलेज पहुंचाने की कोशिश करते हैं. We try to compile it and give to that information to you in as much as to the point and brief as possible, but this is their lifetime's work. So
Yes, please continue. Dr. Vismita.
I think there's some network issue at her.
Yes, yes, okay.
Yeah.
Okay, thank you
yeah,
very
I
much.
think there was some internet issue. I hope you are audible.
Yes,
Yeah,
yes,
we-
please continue.
Okay,
Yeah.
sorry guys, there was some technical error. Many thanks to chairman of E-Academy, IHP, Dr. Rakesh Jain, sir, and obviously not to forget the contribution of our EC committee members, our E-Academy committee members, our national coordinators, and everyone who is associated with IHP, our life members. And guys, everyone is working day and night to provide us with very good ideas for you, and surely we will be coming with great ideas in the future. Please, your ideas are always appreciated. Please log into our website and see what are our future plans, what are our members, and what all we are doing in this field. Do subscribe our YouTube channel so that you get our timely alerts for the future sessions. And definitely, ma'am, we have a lot of ones more coming for your session, so we will definitely be conducting future sessions in the future with you. Thank you guys, thank you so much for your love and appreciation. Please have a very good evening, good night, and God bless.
Thank you,
Thank you
Dr.
so much.
Vismita. Thank you, madam.